Delighted to be here. Thank you very much for inviting me. So a new modality in treating Lyme disease, calibrated, ingestible, plant-based, essential EFAs. I have multiple plant-based lipid patents, I have multiple medically based books, and I consult. A little bit about me. I'm an electrical engineer from MIT. In her 30s, my wife became type 1 diabetic, doing everything she thought was correct, and the physician's recommendations made her worse. So I live in Houston, Texas. We have MD Anderson Cancer Center, biggest cancer center in the world, top 10 medical library, 340,000 medical volumes. I actually had my hands on an issue of an 1850 Lancet. They were kind enough to let me spend years researching there. And what I discovered was the medical science is here, popular opinion is here, they're diametrically opposed. So I spent 10 years researching cancer, 10 years researching cardiovascular disease, and of course diabetes. Today I specialize in essential fatty acids and their long-chain metabolites termed eicosanoids, and I focus now on expedited surgical healing and healing of diabetic foot ulcers. And if you can heal a diabetic foot ulcer, there isn't much you can't do. And what I'm very excited about is a colleague of mine was saying, Brian, why aren't you lecturing or presenting at Lyme conferences? Because with the metabolic pathways from your healing, they're the same ones that need to be helped for Lyme patients. It's very tough. I said, I don't know anything about Lyme. I said, I know it's from a tick, and that's about it. So I started researching it. And my goodness, do you have your job cut out for you? But it's the same metabolic pathway, so I'm extremely excited to be here. So once I talked to her, and she treated Lyme patients and got very, very good results with what I'm about to talk about. Many of you prescribing fish oil to your patients, just want to get an idea of that because there's a section here I'm going to go through how fast it is. I think after this, you're going to completely reevaluate that because it's actually impeding their healing. This is very underpublicized information, and it's a real tragedy. So I've spent a lot of time minimizing what's written on the slide so you can concentrate on listening to what I'm saying. And Dr. Peterson had a very wonderful idea of offering the presenter's note. So if there's any area you want more information on, you can send me a quick email and I will get it to you. Just this month, Nobel Prize Medicine, Physiology or Medicine was awarded to being the discovery of how the body senses hypoxia. Now, the researchers didn't know how to bring the oxygenation back to normal, but in the next 30 minutes, you will. So it's very, very exciting. We're also filming this presentation so you can refer to it later, so please spend more concentration on listening to what I'm saying instead of trying to read. So it's very, very exciting. So there's 4 areas where your treatments will become more effective and your patient outcomes will be maximized through a calibrated lipid formulation of essential EFAs. And I'll tell you what they are in a minute. 4 key areas: increase the immune support to better tolerate treatment, of course, resist relapse, increase cellular oxygenation. Dr. Gordon was talking a lot about that. Kill biofilm-based and other bacteria, decrease fatigue, increase energy, increase gut integrity to withstand the damage caused by antibiotics, maximize the medication, nutrient absorption, increase blood flow. Got to be able to, number 1, increase more oxygenation, and 2, get the nutrients to the patient and increase the drug delivery too. So we're going to utilize life sciences, concentrating heavily on physiology, secondary to biochemistry. Typically in the medical field, it's more on biochemistry, and they miss key points. They assume the substrates are all functional. If they're not, you have a big problem, and you're going to discover why they're not. So these are epigenetic solutions. They're applicable to every modality as an adjuvant with no contraindications. That's a big thing. There are none. State-of-the-art medical science, most health professionals haven't seen before. Why? Most here are clinicians. You're reading JAMA, New England Journal of Medicine, Lancet. I'm reading those medical clinical volumes too, but I'm also looking at the Journal of Biological Chemistry, Journal of Lipids, prostaglandins, lycotrienes, essential fatty acids. I'm in the hardcore medical sciences, and oftentimes you never see these articles, and there's a few, I'll bet very few of you have seen, that are landmark breakthrough and absolutely incredible. So ingestible plant-based EFAs, what are they? There's only two. Linoleic acid, that's LA. It's omega-6, alpha-linolenic acid, that's omega-3. Biggest thing, your body can't make either one of them. You don't get these from food, you're dead. Essential EFAs and EFAs, the essential difference. What are you talking about? An EFA stands for essential fatty acid. So why am I using the term essential fatty acid? Isn't that redundant? It is. I apologize for it, but I've been forced to because so many in the medical profession are using the term improperly. The only two EFAs are LA and ALA. DHA, EPA is what's called a derivative. They are made from the essential ones. So because everybody is virtually using the term wrong, I will refer to LA and ALA as an essential EFA. So I'm sorry for the grammaticists out there, but I'm forced to. Superior plant-based oils. What's the big deal? They must come from food. Seeds are ideal. Flaxseed, sunflower seed, evening primrose seed. Most seed oils are in the omega-6 series, like a walnut seed. It's much more essential omega-6 than omega-3. 100 trillion cells. Every one of those cells in the lipid portion of the membrane is 25% to 33% of the essential EFAs. That's a quarter to a third, so they're structurally incorporated into every one of your 100 trillion cells. Mitochondria, hundreds to thousands in each cell. They're there too, and I'll tell you a key point in a minute. Breakthrough finding was 2017, and I'll bet you very few of you saw this. Secretory cells are hypersensitive to changes, like oxidized lipids or a trans fat, of their membrane lipids induced by the diet. Lipids induced by the diet. So what your patient is eating is going to set up a condition making the cell hypersensitive. An example of that is a plasma cell antibody that's supposed to attack the bacteria and virus. Well, if it's inflamed, it can't. So what your patient is eating is influencing the hypersensitivity. How it can sense that it's wrong, it's a thermodynamical thing, and the way it fits, you don't need to worry about that. The point is, it actually is hypersensitive, and that's causing chronic inflammation, by the way. So in addition to the real problems your patient has, they've just created another one by eating something, and we can counteract some of that. So important for treating all Lyme patients, 50% of every membrane is fat, the other half is protein, there's very little carbohydrate. PGE1, prostaglandin series 1, is the body's most powerful antioxidant. We'll talk about that. PGI2, prostacyclin, is the body's most potent natural anti-aggregatory, anti-adhesion, so the platelets can flow and you get more blood flow, which equals more nutrients, more oxygen, more drug delivery. Big difference between the essential omega-3 and the essential omega-6. Essential omega-3 is never adulterated or processed. It's not used in food. It's too reactive, so they don't fry with it. You never fry in flax oil. You never cook with flax oil. Essential omega-6, on the other hand, diametrically opposed, almost always processed, adulterated, non-functional. The reason is you can't have bagels or cereal smelling like fish that's gone bad, right, or a butter substitute. Nobody'd eat it. So it's wonderful for the food processors to get long shelf life, and you need that. But they're killing us. So it's a two-edged sword, and unless you can counteract that, you have a major problem. You're going to be shocked with the calculation I'll show you in a minute. So insights learned from other fields. Again, I've been in cardiology, oncology, diabetes, wound healing. Here's 8 different areas that you're going to see how they're maximized. Does the science predict the real life result it better? I'm a theoretical guy. Basically, theoretical physiology is what I'd say I do. But I have to have what theory says actually works in a clinical case. Here's an example. 86-year-old patient slipped off a curb in winter, actually in Massachusetts, fell face forward onto the asphalt. Within 2 months, here's the healing. Every picture there, she still has energy. She doesn't look half dead or anything. Has more energy than some of you in the audience right now. But I mean, this is incredible. 86 years old. If you want the actual ENT's comments, you can send me an email and I will get those. Remarkable. No bone fracture in the cheeks, no breaks, no concussion, 1 day in the hospital, no pain pills. Now, this patient was taking the essential EFAs prophylactically for about a year before she fell. You'd still get the same result, but it'd probably take another 30 days to get this. But because she was so optimized, this is unbelievable. So you have to have the blood flow, you have to have the anti-inflammation, you have to have the oxygenation, you have to have all these pathways, or you would not have a remarkable healing like this. If you want to look at all the pathways at home, you can. I've been very extensive on the references, why this happens. It's not magic, it's based on science. You have the skin integrity, for example. All of your skin here is essential omega-6. Fingernails, all essential omega-6. If you're wondering, does this work? Give this to any woman or any man. Your fingernails become like glass in 30 days, and they're unbreakable, ladies. You don't need to go running to the nail salon. Every woman, I'm all about health. I don't care much about the beauty, but you get that for free. It is unbelievable, and your fingernails grow like you wouldn't believe. So that's the proof of the epithelial tissue. And you want that growing. So you get skin integrity, less joint muscle pain. That's because of the PGE1, the body's #1 anti-inflammatory. Infections minimized. Bacteria is killed because of the increased cellular oxygenation. That was Dr. Campbell, 1976, brilliant work. Nobody picked up on it and expanded on it. So I'm standing on his shoulders. I'm standing on a lot of shoulders of very, very brilliant people. And I'm very good at connecting the dots by being an engineer. That's what's lacking in medicine today, as Dr. Gordon was talking about. Bless you. You need someone to connect the dots. I connect them extremely well and lead to advances. More energy, less fatigue because of the mitochondrial support. Excellent for diabetics. Biggest epidemic in America and the world today is everybody's becoming diabetic. We can make big improvements in that. Fewer headaches because of the increased blood flow. Another landmark 2018 finding, highly underpublicized, to minimize the biofilm infection. Fat body cells containing significant essential EFAs, if your patient has them, actively migrate to wounds to drive repair and prevent infection. So the fat we have is supposed to be mobile, going to infection sites and healing sites, not just stationary. Anybody see that article? 2018, this should have been all over the news. Nobody. This is what I'm talking about. This is enormous. And everything I talk about is a lipid, it's fat-based. So these actually move to the site that needs to be healed. Going to talk a little bit about DHA EPA because so many physicians are prescribing it and it's the #1 supplement in America. 2005, 2008. Omega-3 derivatives are made in extremely low amounts. Supplements are not required. Yeah, they're not required. First question is for a guy like myself, how much DHA EPA is used in the brain every day? Anybody here know that? Anybody here ever seen it? Anybody here ever asked a question? I'll give you the answer because the National Institutes of Health has it. 7.2 milligrams. That's at the tail end, 2 or 3 standard deviations out, meaning that's the biggest brain person you'll have is 7.2 milligrams. What's a standard capsule? 1,000 milligrams, 60%. DHA EPA, that's 600 milligrams. 600 divided by 7.2, that's nice, 80. One fish oil capsule is an 80-fold super pharmacologic overdose of what your brain's using a day. But Brian, there's other areas that DHA EPA is used. Fine, the eye has it. Let's double it. I'm a conservative guy. I'll give you 15. You're still at 40-fold overdose for one capsule. You have physicians recommending 4 grams a day of fish oil on a daily basis. That's 160-fold pharmacologic overdose. To put that in perspective, have your patient take 100 aspirin and see you in the morning. Don't do it, I'm being facetious, you'll die. This is what's going on. I'll give you more. We're not done. It's in peds healing. Substituting omega-3 fish oil for the omega-6, highly deleterious to properties of wounds, it impedes healing. So it'll impede a gash, it'll impede all healing. The reason is there's such an overload of the omega-3 series, it displaces the critical omega-6 series. Your body will not just oxidize and burn it up in beta oxidation. You take too much, it's just going to be magically vaporized. No, it gets shoved into a spot that it shouldn't be. So horrible, horrible. Here's another fact nobody has seen. Fish oil's horrific inflammatory oxidation. 6-fold oxidation in basil, 26-fold increase in autooxidation, 42-fold in iron ascorbic catalyzed oxidation compared with the omega-6 series. So fish oil is turning rancid at room temperature, number one, never mind 98.6. It is going bad immediately. What happens? All your body's antioxidants are rushing to solve the problem of this being taken in as a supplement, and now you don't have the antioxidants being where they need to be, healing. We've done it to ourselves. Physicians have never been more misled in an area than with fish oil. This was all made up. I talk extensively about it. I'm the biggest anti-fish oil guy in the world, but the science shows it, and you're going to see more. That was incredible. Fish oil decreases immunity. That's really what a Lyme patient needs, less immunity. Wonderful. This is right out of the package insert of a pharmaceutical fish oil drug. Acts as a long-term steroid. Anybody here think a long-term steroid is just dandy? Short-term, I have no problem with. If you think a long-term steroid is good, you ought to have your license taken away. It's horrible. 2006, fish oil damages cellular mitochondria. Lyme patient needs all the energy he or she can get to keep the energy going for repair. This damages it. Gets worse. 2018, another landmark discovery. Fish oil ruins mitochondrial cardiac enzymes by up to 50%. I had to read this article 3 times. I couldn't believe it. Doesn't that lead to congestive heart failure when your heart doesn't have the energy to pump? That's what fish oil is doing here. 2009, 2014, the American Heart Association champions omega-6. How many here have heard omega-6 is bad, we're all overdosed with omega-6, arachidonic acid's inflammatory and going to kill you? Everybody's the answer. I don't even need to ask it. It's a facetious question. It's been reversed. They missed one word, though, an adjective, adulterated omega-6. They always adulterate the omega-6 to get long shelf life so it doesn't go bad because it's used in frying, baking, cooking. So the majority of the omega-6 we're eating in a regular supermarket is oxidized, it's ruined. All the problem with the oxidized cholesterol, by the way, little side note, it's oxidized from the essential EFAs. Cholesterol is magnetized to the essential EFAs for transport in the bloodstream. Okay? It's called esterified cholesterol. And it's oxidized outside the body. It's exogenous. So you're eating the food. Cholesterol is very resistant to oxidation in the body. The essential EFAs are very resistant to oxidation in the body. We're getting them from the food we eat, brought in. Most people don't know that at all. It's a very, very big thing. It's incorrect about LA and AA being inflammatory. This is their quote, not mine. Anybody see that? 2009, 2014? How about 2017? Here is another one. Is what I'm talking about. Now actually this one, what magazine was it? Yeah, Journal of Clinical Nutrition. You're not going to read that either. It's not a clinical magazine. So 2017 confirmation, omega-6 fatty acids do not promote low-grade chronic inflammation. After adulterated, they do, but a fully functional one like I'm talking about doesn't. The higher the serum essential omega-6, the lower the CRP, the inflammation marker. Just the opposite of what you've been told. Processed essential omega-6 causes decreased cellular oxygen. So if you get the fully functional essential omega-6, that is the equivalent of your patient being on a cellular hyperbaric oxygen chamber 24 hours a day. That's the result you get. And Lyme bacteria, as you already know, die in high oxygen environments. Everything dies in a high oxygen environment. Mold can't germinate. That was proven years ago in 56, 55. And it's been proven when you have high cellular oxygenation in the bloodstream, this stuff doesn't germinate. It's the way you kill everything is oxygenation. So I love oxygenation. And a colleague of mine, Dr. Rowan, everything he does oxygenation. So very, very big on oxygen. Lipids are the number one modifiable variable in tissue composition with the potential to impact healing. Thank goodness. The number one thing that's modifiable is lipids. Well, it's good and it's bad. If you're eating adulterated ones, like everybody is, they go into the cell tissue in proportion to the amount ingested. This was Dr. Lanza in 1990 proved this. Very, very good result. He's a biochemist guy. Excellent job there. So it goes in proportion to how much you're eating. So the key is I can't eat anything from any fast food place, any junk food, anything I really like. No, you can. But if you're not counteracting it with the fully functional, essentially EFAs, you're going to lose. And this is heart disease. This is cancer. It's even dementia. We'll talk about that too. So thank goodness, what's the number one lipid that's modified in the diet? The essential omega-6. Again, so the cereal, the oatmeal, the bagels don't smell like fish that's gone bad. It's impaired. The oxygen transfer is stopped. Great for the food to last forever. Just like margarine, put it out in the garage, it lasts for a year. No bug will touch it, no bacteria, no fungus, no mold, nothing. It's a plastic food. If you ask a plastics engineer, what is this stuff? It's plasticized food. It's not even food. Nobody will touch it. So it's great for food shelf life from the food processors, but it kills us and causes our diseases. This is the number one problem in the world, by the way. It's essential fatty acid adulteration. It's not even talked about. It is mentioned, but it's not. Impairment of fully functional omega-6, lack of oxygen. Well, what's that? Chronic fatigue. Is there an epidemic of chronic fatigue? Yeah, Lyme's got it, of course, but it's epidemic. Number one problem in America is I've got no energy. I had virtually no sleep the night that I flew here because my wife was up every couple of hours just because she doesn't like it when I leave. So I had completely interrupted sleep then. Yesterday I had 4 hours. I was up at 4:30. And how do I look? How do I talk? Any problem with me with fatigue? Any problem with me with cognition? Any problem with me with forgetting things? This is all the results of these essential EFAs. I'm telling you, I didn't used to be like this. I was like everybody else. Eat at lunchtime, where's my nap? Gone. Thank God that's gone. Most people have no idea what you should feel like. You're so used to feeling horrible, it's become the new norm. By everybody. They walk around a zombie, they smack into you, they don't even know because they have no sensitivity. People walking around with neuropathy all over the place, it's an epidemic thing. This all can be fixed. Okay, here's a standard chart. Pathways, only 3 things I want you to get out of this. On the right side, the top half from that second rectangle, that's all the omega-6 series. Bottom is the omega-3. Look how much more prolific the omega-6 is. The omega-6 series and their metabolites and eicosanoids are 20-fold more powerful than anything in the omega-3 series. Don't let anybody tell you anything to the contrary. They're making it up. All the powers in the omega-6. 2 more things I want you to look at. PGE1, top left. That is the body's most potent anti-inflammatory, which your patients need, and a bronchial and a vasodilator. So it starts in the lungs, opening them up. Anybody with asthma, huge help, and a vasodilator. On the bottom left, in red too, prostacyclin, PGI2, the body's natural blood thinner. Platelets can't stick together, can't stick to an artery wall. I don't know how you would get a heart attack taking the essential EFAs unless you are chemically induced around paint all day long or through a radiation field. I don't know how it would happen. Want to see a cool result with it? Well, you will in a minute with a clinical result. But here's another one, 2018, superb article on biofilm, superb article. Bacteria migrate, altering coagulation and fibrinolysis pathways and the immune response, and hits the central nervous system in a mere 2 weeks if it's not impeded. So, number one, prophylactically, because you only have 2 weeks, you may be able to get a patient right away, is the ideal way, but 20% fibrinogen decrease with the essential omega-3. The essential omega-6, PGE1, PGI2, release plasmin to dissolve the fibrin. Plasma fibrinogen did not decrease with fish consumption in the least, so once more again, delusional. Decreased plasminogen equals less biofilm problems in Lyme patients. You have to have the blood coagulation to get the problem. So you get rid of the coagulation. That's everything fibrin and plasminogen do. You're not going to have any problem. If the blood flows there, it doesn't harbor. And we can keep it going with the essential EFAs. Prostaglandins are capable of limiting thrombosis, so there's no arterial clogging in both the arteries and the veins. Prostaglandins can reverse thrombosis. This was known in 1981. Incredible. There's no reason to be getting heart attacks. Mitochondrial maximization from cardiolipin. What's cardiolipin? It's the inner layer of the mitochondria. It's 100% essential omega-6. From all my work in cancer, abnormal cardiolipin, irreversible respiratory injury. The reason you get cancer is there's no cellular respiration. If it can't utilize oxygen, you're going to get cancer. Warburg, that's all Warburg's work. That's where I spent for years. Brilliant, brilliant work. So if you have impaired essential omega-6, you get an impaired cardiolipin in the mitochondria, you get insufficient cellular energy to expedite killing of any biofilm-based bacteria. So you need the essential omega-6 and its associated oxygenation. If you look at the dissociation curve, the cell membrane can dissociate and release oxygen there too. It's much more than just what's going in and out. Oxygen's a small molecule. It just diffuses automatically. The cell membrane doesn't matter. I've had numerous physicians say this, thinking they're wise guys. I said, okay, if I take a piece of plastic, how is your oxygen going to diffuse? Well, it's not. I said, what do you think a trans fat or an interesterified fat in the membrane does? It impedes it. The cell membrane is key to everything. Warburg had this, and actually in one of my books, that was my first page. It's not what goes in and out of the membrane, it's the membrane itself. Nobody gets this. Nobody. That's how the increase in cellular oxygenation is so prolific. Another major thing, digestive tract lining is all epithelial tissue, which is your skin, as is the arterial intima. So all my skin is all essential omega-6, period. But Brian, the fish oil makes my skin smoother. How? It's not in there. Is there a puppet master doing something? There's no fish oil in your skin. How on God's earth can it possibly make it smooth? I'm a hardcore scientist. Magic doesn't count. I'm in a straitjacket. 2 and 2 is 4. You don't get to go into an alternate universe and go 2 and 2 is 24 because you want it to fit your theory over here. You can't do that. So everything is the same. Now, there's a lot of focus on probiotics today. What happens if you have a leaky gut and your whole digestive system is compromised because the essential omega-6 is leaky, it's not working? The focus needs to be there first, then you can worry about probiotics. Same thing with the intima, the inner lining of the artery. My skin is smooth as heck, my fingernails are like glass, so is the lining of my arteries. And you're going to see this in a second. When oxidized, essentially EFAs from food are consumed, cellular oxygenation stops. We need it for intelligence. Yeah, you can use glycolysis all day long, and cancer cells do it, like Dr. Gordon said, but there's no intelligence. You just have a mindless growing thing surviving like a yeast. It's not what we want. This number is horrific. If I just have 1% ingested, oxidized essential omega-6, I have 100,000-fold cellular toxic overload on each cell in your patient's body. That's like me here knowing martial arts real well, and there's 100,000 of you just coming up. Take your martial arts and shove it. 100,000 to 1, the calculation's there. What happens? Healing becomes virtually impossible. Chronic inflammation once again. A little damage goes a long, long way. Essential omegas, EFAs, increase blood flow so the medication works better, more effectively. Does the science predict the clinical outcome? Damn well better. Remember, I'm an engineer first, theoretical eye after. I love the theory, but I always have to know it works. Because if I don't get an 80% success rate, I failed. If you're a pharmaceutical company, you get 1%, like a statin. The NNT is 88, maybe 100. That means 1 in 100 it works over a 5-year period. Great job, 1%, that's 99% failure rate to me. If I'm not successful 80% of the time, actually I shoot for 100, but there's always things the patient does that doesn't tell you. 80% failure. Quote, never seen such a remarkable result. This was in a smoking patient, statins, aspirin, CoQ10. When he stopped the essential EFAs, the plaque came back. So this is ideal cause effect, not a association like most medical studies are with their relative NNT risk that don't mean anything. This is absolute cause effect. Stop taking it, just did it on its own, got another measurement, and the measurement was 64 slice CT. Never seen such a decrease in coronary artery plaque by more than 5% in a year. Who is this? Former chairman of the board, Nuclear Resource Committee, American College of Pathologists, Dr. Kagan, esteemed radiologist. So it works. Here's the pathways, multiple metabolic pathways, maximized simultaneously. You can read at home. Improve cellular oxygenation, mitochondria function, healing, anti-inflammation, anticoagulation, anti-adhesion for the platelets in the cardiovascular system. The essential EFA is adjuvant in treating many chronic conditions, anti-diabetes, anti-aging, anti-cancer risk. Big one is less dementia, and this is because of the central nervous system. 2018 landmark article, you may not be aware of this. The neurons in an Alzheimer's patient, they're not dead. Anybody here see that article? They're impaired. They're not dead, so the neurons are not dead. Recently attended a Methodist hospital in Houston conference on Alzheimer's. It's a vascular disease. So you can read and do all the crossword puzzles you want, take it to the bank. It will not help you one iota. It's physiologic, period. The key, what feeds a neuron? Capillaries. Hundreds of millions of capillaries in the brain. What's capillary made of? Essential omega-6, 100%. That's where the nutrient delivery is. That's where the oxygenation is. If those are impaired, you can't think, you have no energy. That's Alzheimer's. But Brian, what about the beta amyloid? Real simple. If the cell membrane doesn't have 100% integrity, it's leaking, it's falling apart. The beta amyloid's a protein. It falls out. That's it. It's an effect, not a cause. That's why in the past 30 years they've gotten absolutely nowhere. And they won't stop. They're a one-track. Pharmaceutical people are just unbelievable. I talk to them all the time. They're incredible. They're in such a straitjacket, that's why they get nowhere. Billions and billions wasted on this amyloid nonsense, and they don't look at physiology first. Just like we heard in the first presentation. The physiology is where everything has to start. Essential EFA support, all these areas. Brian, how can they do this? Wrong question. How can they not do this? They're completely fundamental. They're in every cell in your body, and through their long-chain metabolites, they do all the signaling. Also understand lipids control proteins. Everybody concentrates on proteins. That's why we get nowhere. What's controlling the protein? Oh, nothing. They do it themselves. Wrong. Lipids. That's all in the epigenetic. What's required for Lyme disease healing? You need organic. You certainly can't have chemicals or processing. You need a ratio, 2.5 to 1 to 1 to 1, in favor of the essential omega-6. You need GLA because there's an impairment in the delta-6 desaturase enzyme that makes the PGE1 in Lyme patients and in patients with many diseases. You need high essential omega-6 with minimum OLEC. OLEC is a non-essential. It's a waste of space. You need a hard gel cap so there's less oxygen transfer. No fish oil. Hope you really reevaluate the fish oil, and you could watch this at home when you get the video of it too. No borage oil. But Brian, borage oil has got 24% GLA, it's more. Stereochemistry is wrong. You have a very bad thromboxane A2 issue. You don't want it. Pianicidine, secondary aldehyde. Nobody looks at that. All they do is look at PV value. PV values are almost meaningless, just like potential in A power line, you can have a 1,000,000-volt potential, does nothing. That's why birds and squirrels are on it. But you cross it and short yourself out, you're dead. So you want to be looking at the p-anisonine. You want less than 6. Guess what? Fish oil's at 19. Borderline toxic. That's borderline toxic. Quick little side note, if anybody's looking for a great detoxifier, blood purifier from my years in cancer, something called EFAs, I recommend adding cat's claw to it for a turbocharged EFAs. If you care about that area, you can certainly drop me a line. By law, I cannot give brand names. Okay, I just can't do it. I've gotten in trouble before, and I can't do it anymore. You can't do it anyway. But colleague from University of Pittsburgh was gracious enough to join us today, and he has information on what I recommend and what I personally do prophylactically, because I don't want to get any of these ailments. So if you could take one of these later on when we're done, and hopefully you can join an informal study with the essential EFAs and treating Lyme patients. We've already got some patients doing it with physicians that are getting excellent results, but we need more. 1 or 2 isn't enough for me. You know, we get 20, so I'm hoping we can get 30 or 40 of you that are very interested in this. Feel free to take a snapshot of this. Here's contact information. All next week, I will make my top priority answering any questions you have. Just put ILADS in the subject line. With this information, you should be able to put into practice solutions next week. It's that strong. I can't stress this enough. I'm delighted to be here. I'm happy to stay over. I know there's a break, and answer any questions I may if I can. If I can't, I'm obligated to tell you I don't know the answer. I don't make things up. I'll tell you I don't know. I have more respect for people that say that than ones that make up things. But do we have time for any questions, or I'm out of time? You're getting 20 years and 40 minutes. I'm sorry to go so fast, but it's trying to take a drink from a fire hose. But I'm happy to stay and answer any questions personally, or we can just stay here, whatever you want. Dr. Peterson. Oh, we can get 4 minutes of questions, and then I'm happy to stay here, and I'll answer them individually.
There was something that you paired with the EFAs, and I missed it.
Cat's claw. It's another herb. It's the best upper respiratory for helping asthma, getting increased oxygen. You put them both together, it's phenomenal, and minimizing the negative effects, because I dealt with radiation patients and chemo, so it's superb. Sure you can. Yes, there's no contraindications at all. Excellent question. I'm on other blood thinners. No problem at all. You'll typically be able to take some of the other ones and cut them down. But there's no contraindications. We have a cardiologist check this. Excellent question.
Can you just comment a little bit about the Mediterranean diet or the olive oil?
Yeah, olive oil, excellent question. Mediterranean diet, olive oil is a 0. Our diet with oxidized omega-6 is a -20. So eating a ton of trans fats a -20, eating olive oil is a 0. There's virtually no essential EFAs in there. Maybe 7% is olive oil. But it's lack of a negative. So I'm a life systems engineering scientist, so I look at how good something is, how bad something isn't. Excellent question. Mediterranean diet's a 0, and that's much better than we're doing, but I can increase that tenfold, and so can you. Yes, cat's claw, yes. Superb. Also, non-stimulating, non-irritating. That was actually the first thing I started playing with for my wife's diabetes. Every day I've taken that. It's non-stimulating, non-irritating. It is the best blood purifier I have ever seen working in cancer and everything else. Fungus, mold, yeast, phenomenal. And it works completely different than the essential EFAs. You put the two together, what a powerhouse you have. ADHD, phenomenal to add to it. Makes their brain work better. We've had excellent result in that. Less carbs, of course, but you add those two, excellent.
What about eating fish?
Eating fish, excellent comment. It's not a processed food, so eating the fish, it's not a supplement with concentrated oil by a food processor. You can do that. I would go for wild fish, of course, but Remember, fish oil is a processed supplement, unnatural. It's made. You would never get those kind of dosages eating, ever. But you can eat the fish.
If someone is already eating plant-based and lots of nut butter and seed oil, is this too much?
Seed oils they get better be organic. That's my big question. If they're not organic, I have no confidence in them. I don't believe what anybody says. You put on the label what the heck it is. We try. I don't care how you try. I care about what you do. Yeah, you can get too much of the omega-3 series. You can get too much of the omega-6 series, too. You can do too much, but typically more in the omega-3, you'll bleed.
The omega-3, omega-6 ratio and all the are now offered by laboratories like Quest that you do.
Sure, you can measure them, but the point is, for a supplement you want this, you can get all kinds of blood analyses done, and what they do is they make an artificial number, the DHA EPA. Just like they make an artificial number of where your cholesterol is supposed to be. What's that based on? What we want it to be. Same thing with DHA EPA, so I tell everybody, go ahead, get it analyzed. You'll see how things change when you take the essential EFAs, but don't go by what their standards are and what they suggest and why you're out of range. So on my website, I have what mine are, so you can take a look at those as a good reference. Yeah, if you send me a quick email, I can give them to you, depending on what the patient has. Good question. It's garbage. That an answer. It's not worth the paper it's printed on. There's 3 I'll tell you the answer. Don't sit there laughing. There's 3 pharmaceutical companies. If there was a fish oil outcome that actually worked, one of those fish oil companies would have it for cardiology, for cancer, for anything. What's it for? Lowering hypercholesterolemia or triglyceridemia. Big deal. One indication, that's all they could get. Now, there's one coming out for the heart disease. Did you see what their quote placebo was? Anybody here now? Lavazza. What was it? What was the placebo? A poison. It's called mineral oil. That was a placebo. So you're putting the fish oil against the mineral oil. The fish oil is just less of a poison than the mineral oil. That's why you got a relative change. Answer your question again, get the Cochrane analysis. They're the best research board in the world. They looked at all the fish oil studies. Out of the 15,000, 22 were worthwhile looking at and complete failure. Why the heck would you do so many studies? I study gravity, I do 2 things. I drop a brick on the ground, it goes, and then I have you do it over in California. You drop a brick, it still goes on the ground. I do 2. I don't need 2,200. 5% confidence interval, I can go on and on, but it's all I do. You can understand, it's in the hobby of me. 5% confidence interval, meaning if I do 15,000 trials with fish oil, 750 of those will have failed but appear to be right. Okay? So they will actually have a failed outcome, but they appear to be right. So we get fooled all the time. This is what I write a lot about. I can go on and on and on. I've given you the guidelines of what a brand needs to be on that slide. That's what you have to look for. And I can tell you there's very few out there, but there are some that do it right. And I appreciate your time very much. I know it's valuable. I hope I gave you something new.